Hey, it's Dr. Mckinney of Blue Mountain Wellness. I'm excited. Justin, you came up from where?
Florida.
Florida, here to Pennsylvania. We're going to be doing quantum surge. It's a protocol we have at Blue Mountain Wellness where we do quantum functional medicine with a whole pile of other different mechanical and physical forms of chiropractic and therapies. Specifically though, you hurt your back when?
About 2 months ago.
Okay, and you were almost just the other week, almost went under the knife for surgery, is that right?
I did. So it got so bad that I actually had to go to the emergency room after a few days of not being able to sleep, and they were thinking about surgery. They admitted me for about 3 days to the hospital.
Okay, so you got released from the hospital, did not go under surgery, thank God. So you're here so we can help you out. So we're gonna do a whole host of different therapies and treatments over the course of the week, and that's the idea behind the whole surge. We're putting a whole approach together. So we're gonna start out with seeing my physician assistant, John. We're gonna do some trigger point injections to get some of this inflammation down. But in the meantime, I'm gonna do a quick workup exam, and then we're going to get you started on the quantum functional medicine protocols. And what we're going to try to do is increase your cellular energy so we can help your body to heal. So we're going to do things like pulse electromagnetic frequency, photobiomodulation, microcurrent, hydrogen therapy, all just to get your cellular energy increased. Right now you've been pretty tired and beaten down.
Yeah, I'm pretty beat.
When your body is that acute and that sore, it's just a huge energy drain. So if we can increase that and then do some of our chiropractic modalities, we're going to do some photobiomodulation with red light therapy, we're going to do decompression therapy, and I'm going to show you guys exactly what we're going to go through. And our goal is at the end of the week, Justin, that you're feeling really good and we can get you the rest of your therapies back closer to home. All right?
Awesome.
You ready?
I'm ready.
Let's do it. So we know that you had the MRI and it showed a disc bulge at your L4 and L5. So we're going to really focus on those areas. And I'm feeling the joints right now, and we can see that there's some dysfunction with just how things are mobilized. So this is a leg check, and it tells me some rotation going on in the pelvis. So we're going to start you with the QFM side of things, okay? And then we're going to do some chiropractic manipulation, and then we're going to do some different things to increase joint mobilization. So right here, this red light, okay, this is going to penetrate near infrared spectrum. It's going to penetrate his brain, and we're going to get some increased blood flow to the brain. Right now, a lot of the pain that's going on with this feedback loop, we got to break that so the body can start to relax so that it can heal, okay? And the healing is going to take place with some of these other therapies. But right now, we want to just get things relaxed and increase this energy. So the next thing we're going to do is hook you up to some hydrogen. Okay, so we got Justin all hooked up right now. We're doing photobiomodulation to his head. We have him set up on microcurrent. It's transmitting through his spine. We have PEMF, and then he's breathing in hydrogen, and all things to increase his energetic debt because he's completely worn down with his disc injury. So we're going to do this for about 30 minutes, and then we're going to get him over here. We're going to do some conservative chiropractic decompression therapy to work on stretching that disc in that lower part of his spine. And then we're going to finish things off with some full red light therapy. Everybody loves that. And then we're going to do it all over again tomorrow.
Hi, my name is John. I'm the physician assistant here at Blue Mountain Wellness and Regenerative Medicine. And our patient Justin today is having some right lower back pain in his muscle along the spine, and so we're going to do a trigger point injection in Justin today to help relieve his inflammation, his pain, and some of his swelling under ultrasound guidance. So I'll go ahead and Allison can move around if she needs to. So Justin, I'm going to have you just lean over the bed and use the armrest like this, okay? And we'll pull that down just a little bit. Go ahead and lean over there. And now, with one hand, I'm going to have you reach back again and show me like where that area of pain is. Now, I see a little red spot right here where we were palpating before, where we were touching before. Yep. Do I kind of have the spot there?
Yeah, it's like right there.
Okay, so which finger? You're using four fingers, one finger.
It's like right there.
Okay, good. I got it. Good. So first thing we're going to do is going to mark that area for the injection, and we just mark it with the tip of a blunt needle so that we can see. Okay, so you can see a little mark there where we marked it. Next thing we do is clean, first with alcohol, and then with chlorhexidine, which is an antiseptic sponge. And now what I'm going to do is I'm going to infiltrate some 1% lidocaine without epinephrine just into the skin under the shot injection area to numb it up so that the shot is more comfortable for him. You'll feel a little pick and then a burn, Justin, okay? Just a little pick, some burn. You just raise a wheel and that part's done. Okay, so after we did the 1% lidocaine for the local anesthesia, we're going to actually inject a combination of lidocaine 1% without epinephrine and triamcinolone, which is Kenalog, a type of steroid. And this is called a trigger point injection. So palpating the area of the pain, and there is spasm because I can feel tightness and also a small lump in there. So we'll do the injection now. You're going to feel a stick. Okay. Into the muscle, making sure we pull back on the plunger to make sure that we're not in the blood vessel. And then slowly and steadily injecting. And while we're injecting this medicine into the area, he should feel pretty much good relief almost immediately from the Novocaine part of the shot. And then the steroid part of the shot will kick in about 24 hours. Okay, so we're done. We massage the area to make sure that we move the injection fluid around into the muscle and that it doesn't stay in one small area. Applying direct pressure to make sure that there's no bleeding, what we call hemostasis. And we inspect the area, which looks like it's not bleeding, and apply a sterile Band-Aid for a bandage. And that demonstrates a trigger point injection into a paraspinal muscle. Thank you for watching.
Okay, so Justin just wrapped up with the QFM. He got a trigger point injection. Now we're gonna do some chiropractic. We're gonna do some cox flexion distraction to open up that joint space, do some manual manipulation to help get some mobility in the joints, and then we're gonna send him over here to do some therapies, including spinal decompression. So Justin, I'm gonna have you lay face down on the table.
Okay.
Perfect. Okay. And you can come closer if you want. A little tender in there? Yeah. Okay. All right, so we're gonna start with a light stretch with the low back. He's still tender. That trigger point injection helped with the muscle tonicity. So. Here I'm pushing on the joint, we're distracting it, and we're flexing at the same time. And that's opening up that joint space to free up that nerve. The nerve's, it's impinged and trapped, and it's causing radicular issues down to those toes right now. How you doing with that? Okay?
Oh yeah.
All right, excellent.
I can feel it.
Yeah. All right. Justin, I want you to lay on your left side. And we're gonna, push you up in the pretzel here. So, hold this knee up. If you want to come around over here.
You're also get your
Slide your hips towards me. Okay. So you can see where you had the trigger point injection.
Yeah.
So right now we're mobilizing his spine. We're keeping everything straight, and I'm gonna adjust this little back.
Good, Abby. Good.
You all right with that?
Yeah.
Okay, good.
Right.
Okay, I want you to roll the other direction. And we're gonna have a little bit of a different contact point here. Just rolling. Okay. I want you to sit straight up here for me. And maybe take your arms up like this. Okay. Pull your chin down. Take a big breath in. And just let it push it on.
No, I'm not. Hold on.
Very good. How do I feel? Okay, we got a ton of movement there. So we're gonna go next door. Come on over here. And you can grab your things if you like. Okay. So Justin, we're gonna do spinal decompression. So this chair, you gotta take a seat there. You can start hooking them up. What we're gonna do is the chair is gonna lay recumbent and it's gonna stretch axial out, and then left and right. And that's going to open up the disc in the joint space where he's having issues with that radicular nerve pain down the leg. So all he has to do is sit here, relax, let the machine work, and then we have a couple more therapies that we're gonna continue with today. If you're gonna walk in close to where that separates, you kind of can show it. Down there, where the table comes together, it's gonna start to separate out. Okay, the pull there? Yeah. Okay, cool. It's gonna make you about 6 inches taller. But the table's gonna go left and right, and that's just it's gonna open up those joints. So you might feel some discomfort. If anything's too much discomfort, just shout and we'll reassess. Okay? All right, take it now.
Go ahead and have a seat. I'm going to put this on your lower back. It's going to go right on the skin. It's cold. I'm going to start with you. All right, go ahead and lay back for me. Your head's going to go on this pillow. Just right underneath your knees. Very comfortable.
Yep.
Get this started. It's about 10 minutes for you. And your job is to relax just like that. If it hurts, just let me know. You're welcome. How are you?
Okay, the last lap of today of the quantum surge, we're gonna do whole body red light therapy. So we're gonna use some red and infrared lights. It's gonna help with inflammation. It's gonna help to vasodilate, get more blood flow, and just relax your whole body. And that'll conclude today's visit. How you feeling so far?
I definitely feel better for sure. I feel more stretched out, I guess is the best way to put it.
Good. Okay,
Definitely
so
some relief though.
we're gonna get you over here. You're gonna strip down your skivvies and you're gonna hop in. It's gonna be a 20-minute session, and we'll get you something to protect your eyes. And then when this is done, you can come back out. All right? Perfect. Okay, cool. All right, Justin, so you just finished up your week of quantum surge. I can just see in your eyes that you're looking more energetic. So just talk about your experience and how you're feeling here.
Yeah, so I came here worn down, just tired physically, mentally. The reason I came up is we wanted to avoid surgery, pain pills, things like that. So we did quantum surge. So a lot of different things I did, but all in all, I feel absolutely amazing. Did 4 treatments altogether. Was definitely worth coming up, and I have a good baseline when I get home to continue my treatment. But I feel absolutely amazing. My energy levels are up, my appetite's back. I've been sleeping every single night through the night, which I mentioned before that I just hadn't been sleeping. I was lucky to sleep 2-3 hours a night for the last couple months. So I'm really excited to get home back to the family, and I'm really refreshed. But I just can't thank Dr. Mckinney enough, because I was to the point where I just didn't know what to do, and I feel absolutely amazing now. And the best part of it was there was no surgery or drugs required, which was what my goal was, and we were able to accomplish it. So really happy, and I'm definitely more of a firm believer in this type of medicine for sure.
Cool. Well, thanks for trusting us.
Thanks, man.
And have a safe trip back to Florida, man. So we're looking forward to, we can continue to help you out, guide you however we can, but we definitely want you to, continue taking care of yourself down there.
For sure.
And we're happy to help. If you have something similar to what Justin's going through, give us a shout. We have lots of different things, but he did our quantum surge protocol, and as you can see, he's a happy client.
For sure.